Hello, my name is Dr. Rueme Birhiray. I practice in Indianapolis, where I am an oncologist and hematologist. I practice at American Oncology Network or Hematology Oncology of Indiana, and I hold a clinical professorship at Merion University Medical School. I am the CEO of Indie Hematology Education, which is an educational and advocacy organization in Indianapolis. So we're presenting today an abstract on the treatment of follicular lymphomas. It's called the Olympia-1 trial. And Olympia-1 is a study using a new class of medications that are called bispecific antibodies. What bispecific antibodies are, they are medications that have been designed to activate the immune system, and they do so in a very unique way. They have two arms, hence the word bispecific. One arm grabs the immune system, grabs the T cells, and the other arm grabs the cancer cell and brings them together. And that process results in the killing of cancer cells. Almost sounds like science fiction, but it is true. And they are now approved in the treatment of multiple myeloma, in treatment of lymphomas, in the treatment of leukemias, and even in the treatment of small cell lung cancer. Our study was designed to look at a new drug which is called Odronextamab. Odronextamab is a bispecific antibody that targets CD20, which is on lymphoma cells, and CD3, which is the immune cells, brings them together. And our hypothesis was, since those drugs work so well in patients who have relapsed multiple times, for example, that same drug, Odronextamab, when used in a different trial called the ELM-1 trial, we found that almost 70%, 67% of those patients had complete disappearance of their tumor. So the hypothesis was, what if we were to use this in people who've never been treated with chemotherapy, a non-chemotherapy approach? So we did this in a very staggered way in order to be deliberate in understanding the efficacy and safety in patients. What I mean by staggered was the first 12 patients who were treated with Odronextamab without randomization. And we wanted to understand that it is safe to do so. And that is the results that we'll be presenting today. We ended up with 13 patients because we had to replace one patient that left. And I'm so glad to say to you that our results are great in the sense that the complete disappearance of tumor or complete response rate was 92%. Really, it's 100%. And what I mean by that is the one patient who was removed was inevaluable. So that was calculated in the math. If you remove that patient, all the patients had complete disappearance of their tumors. If you include that patient, which is the way we do it scientifically, it is 92.3%. Additionally, we looked at safety, and we found out that the most common side effect of these medications, which is called cytokine release syndrome, occurred, but it was grade 1. And what we mean by that is that about 60% of the patients had fevers. That is what grade 1 cytokine release syndrome is. Did not require hospitalization, and this was an all-outpatient regimen, which is different from some of these same drugs in the space where patients need to be hospitalized. So we're very excited that these results are going to move the needle forward. And so the randomized part of the study is upcoming. The dosing schedule of Odronextamab initially starts with a weekly dosing regimen, and then after that, it becomes every month, and then ultimately every 3 months in what we call the maintenance phase. So initially, the patient is in the clinic for a prolonged period of time. We have to divide the doses sometimes into 2 days in order to be able to give the dose and observe the patients. But after that initial weekly dosing schedule, and the patients go to monthly and then every 3 months, it really is not that intense for patients in terms of the amount of time they have to invest in receiving the therapy. So one of the things we found so far is that in our enrollment, we want to include a variety of patients, a diverse group of patients. We haven't achieved that yet so far. Almost all the patients that we've enrolled so far are white patients. We would like to include the variety of patients who have follicular lymphoma so that our results will be more representative of all the patients that we treat. This is a non-chemotherapy approach, and that is very important Traditional chemotherapy, as you know, is associated with nausea and vomiting, immune suppression, patients getting ill. So far, we haven't seen that. We've seen some infections in this study, but it's all grade 1 and grade 2, which means that the patients really did not require hospitalization or anything much more than that. There was one patient that had grade 3, which means that the patient did require more aggressive treatment. But so far, we feel very comfortable with the safety profile of this drug.